teba sabere ense yago sabere omurayi bwense yago na chiabe no murayi oromobe na bane Nebukadneza na ban Farao musabere egere kiagara no menyeta sense eyo asite yogochi ogenda nda sokura nango cha Kenya so igombia to sabere ense yaito na barayi bense yaito banyara ko bakora ense ye egere to a progressive ya.
Yes. Bia mono sana as your opinion on the same. Ono daktari ngekiabeire nowadays yani munatulegaiga ebichie no twarumana na baitu musalia mungwana naro blogger otoka kangentire nego tebekana mwaka nali bwirutege simaime ngekiabeire abantu kibirengererio mbali bija abantu nabarwaire ngekiabeire buna daktari nendoso omanyita manganaya.
Miamono sana Sara egento ndatebe obugima bwa beiro bokongu.
Yes.
Obugima bwa beiro bokongu na one of the symptoms cause signs ya depression it is hopelessness. Nekiro monte ikire stage yekoro hopelessness they have nothing to lose. Yani eraro chebono nche ni menyanse yekende nkeyo so they can do anything. Kiro monte ikire stage area very hopeless. Utware hopelessness na feelings cha worthlessness yani ncheno monto santa isaini igali bono they can do anything kwanya ko romonta ko kote nchenku waka na ndikende nkeyo yani kende bo kereto ikire ngiruse timoyo kereto ikira sabantu baitu bagukwana igo then abantu babeire ndatebe we are a depressed nation we are a sick nation and again tonke bwanteke ko urgently kiagara nonye abantu kurakora bali baligereri the percentage of all the index of happiness in a country. A country happiness level chabonka yere kwarorire but Kenya we are still a depressed nation. I told you like in Africa we are number 4 worldwide we are number 9 on matters depression. Yes.
All right. Yani okwerusi moyo okonge but tutaraika abo bintombire tokorora biragere bira to machando matuli kwereta bweka so there's some bintombiro bikona kubeta korumage gaiga so that igente kyamanya koba so to you nkiekoro chikiabeire mpaka bona abantu bachakoba batware hopelessness there could be several factors.
Very many reasons Sara. Mangana na mange ago changi omuntu koba hopeless usogotwara depression na ande monne gentonda kwanire getangani it is financial issues number 1. Actually yes Kenya yabono financial issues na chiare tiro muchando bakokorora abantu bachandegete mono number 2 is non-functional families. Was it like a week ago I had a 15-year-old who attempted suicide. Umwana ore myaka 15 orete twatyo bagosanire no mwibori oimokirie lyogorie ye ngombe onyure a very young boy and a bright boy igonto gwategende koro kuna functional families wisoko chunguza mono there's always conflict between the parents abayiboli baye bakonya kurwana lyoka aido mwiboli oyo mono marebi gosaba iboli bonse nabarebi bono kirama bakogosane bakobeko mwana asamanga nabo inere litokoroka chi family chiri non-functional. Apart from financial non-functional families ntobwate relationships. Tukolinde keratware gukwana n'abantu bepigipigi kerato babole tinge nto kiakanenge ko gara abantu bepigipigi bayirusi obomoyo ebatatebeti na mangana ya mapenzi relationships mahusiano konyo aro muntu chire gasi botuko kira kare ko kore gasi umuntu ndo gatire nyumba mwaye kwarorire kago ikegenta akora agwito muntu uri nero ita actually nto arumo jamage tolika Twitter chi story gocha buna bacha getena mukaye buna balenge students gocha lakini akanyora mukayo otwarira another relationship nki akorete alimuwa na yeye akamaliza kujioa ebina ayuna mangana relationships chitari na chira chibwate shida kogara chira abantu batwara depression. Apart from relationships into bwata abantu babwate chronic medical illnesses una cancer diabetes hypertension maruira manga ali omuntu agutumia maliogo for long in their life was chronic pain abantu mbara actually babwate pain yotali koera bagutumia pain killer on a daily basis Another risk factor is people who have an underlying mental issues. Yeah, when once you got an underlying mental illness, but at a higher risk you konyora depression will say you're hopeless because most mental illnesses are chronic. Umuntu agutumia maliogo for a very long time, go say forever. So those are among the risk factors go say bintu biribira agero umuntu atware depression.
What about umuntu go osiria umuntu mwabo umuntu osirire go say is a loved one, somebody has lost a job, somebody bintu binibyo birobi, is it part of the
umuntu kirasirire umuntu a loved one go say a very close relative into what a grieving process. Kira grieving process ya very abnormal, abange ntori koraba beka into depression, abagutore ganto tokoroka prolonged grief disorder, PGD.
Yes.
Mono prolonged grief disorder ina bego predispose monto aso into depression. Igonto what normal grieving na into what abnormal grieving. Abantu mbale bako grief baika ba acceptina ki ayana mapenzi ya Nyasaye na erebwanche to monto yoganda but imbale bako grief
but nayo up to now
1 year yubone koro kwa abnormal grief monto aganta ko grief oikatari korunyomba egento akonya kokwana ningoro yo montori osirete ononto bate you prolonged grief disorder go predispose monto twara depressive disorder go so twale birangare liebinge
ndi daktari montagonete ko grief aiki because I feel like you can grieve forever lakini teko affect in one way or the other or sequelating to depression so much. Grieving
grieving is like an acceptance process, so we accept one na ki oyo igatwanje tochire and sara buna kwatebire we cannot grieve forever but we can remember the person ochire forever and remember the good moments we had with them amangana ye to amenyete na barabwe bintu biriebia but grieving ko grieve forever you want already you have a problem because symptoms of grief unchirichechi no go tachanwe tuki ogotaisibi yani you are just there okolera most of the time kwarolire normal grieving neli tokwala omonto kiro monto nabwate nchira ko grief sara abantu mbali bagukura mbali bakolera lakini monomona abasache bagukira and this is another big problem again to kelitoko men are at high risk of depression than women because of the culture and again to society at so men should be strong abantu abange bakobe ko bororoboli metali atyokolera atali kolera taigwetibobe na igwetobe lakini anaibika kulia mbele ya watu kwarolire bono kubeko mchandoli megaiga with time itakuja kumletea pia depression itakuja kulipuka imletea shida mbaya sa igo utagrieve properly totally tiomonto the right way yoko grief kusewacha umuntu akorera kwa matei kira makweli na makoro umuntu tari kwa tebu give them their space to grieve umuntu arere kabisa aisaneke akikuwa vizuri acceptance takes time but grieving should be for that short period and then kwanya go come into terms as time goes by.
Akini bikore bitoroche bigendete okorekana abantu bakongenta abantu bande, is that really depression or say it's a bad spirit mekagete tuwanete gusabira so that abantu babebuya
bono tigatokwanira igoro ya ntobwate suicide ntobwate homicide suicide nabo gwoka na homicide mono homicide ne libuno kwaro cyo musacho elite to monto alafu neraga akaendi obugima bwa na suicide kwarorire igo homicide sinchire common na ndi mono mone chire common among females no bako bachi target mono because women are vulnerable and they are weak mono most of the time bali konyara go defend barabwa banyene but bono ko okorusio monto ba moyo ntoko ngacha depression ntobwata abantu babwate some personalities ntobwata abantu babwate some disorders chitanya kumanyekana ntobwata abantu bakoro ku narcissists ntobwata abantu babwate condition chikoro ku sadomasochism. Abantu kera bakuinduce pain kuchesa umuntu ndi nali feel relieved. They feel good.
Yeah,
we have those people.
You want to cause pain to somebody, you're enjoying their pain.
They enjoy the pain. Ntubwate actually abantu babwate condition ya sadism erime yabo. So when they induce pain, lakini kirango kwa na mono esema sadomasochism yegocha abantu babwate some sexual disorders. Induce pain when they're having their thing. So lakini ntubwate in real life abantu kunabo kirabaro choko go through pain, that's when they feel good. When they are happy.
Then that is that's abnormal.
Ntubwate abantu babwate actually ntubwate group ka to Gokwanera different personality disorders. Apart from witwateba narcissistic personality disorder, ntubwate yekorokubuna borderline personality disorder. Ntubwate abantu naturally babwate antisocial personality disorders. Kwarolire social immunity mbali kubwate the normal set rules. Barabwe bakora ebintu byabo their own way. Bali kubwate machikali abekire. Bona abana bw'abantu balimo no konyora bale bakubuna amachiko bakora ebintu batabwate and remorse. Mbali gutwara remorse yende yonsime yabo. Mono they are suffering from a personality disorder.
So the difference between these people and depression naye era chande mpako uganigwe korera bobe, but you cannot harm
mono depression no muntu manyene go chanda na andikero you feel like na you're worthless na ndibono hopelessness yeri na yego affect. Although we have some parents bagoteba kiro buno muiboli oruseti abana bayo pamoyo nera kairuso pamoyo like associate bona abana baye na depression yae kinkobatige nseye na kibago chakoba afadhali niende na wao. But ibono umuntu buno uri okugenda ito umuntu nande ere nware serikali iri agoteba the person is the suspect still at large taratogekana. That one there's no depression there. That's a problem. Ntubwata of course abantu babwate disorders bagokora igo and then tubwata abantu bare normal, but because buna whatever spirit chimbe chiachire enda mwamu ne libero liachire muntu nabawito muntu zisori enda mwamu.
That's where we wanted to be very categorical and very clear. Muntu tagori bintathenga it's because of depression. No motigo yuga gigabwate mamangana manga gwetera no. I
can give an example of the dad or Kenyata abana bae babere sometimes back. The guy was known to be a mental issue. Ntobwata abantu babwate mental illness. Bago suffer from commanding hallucinations. You want actually that depression. Depression tari correct hallucinations. Already omuntu orwalire okutwara commanding hallucinations no muntu orwalire mental illness for a very long time. Amali uginara gocho mokwanera more specific instructions amataikoreiga. That one is understood or you know moroire either ne community take step mapema again do muntu yarwaligu abebia.
Yamona sana mwanchu murigereria turi no munyagitari ito Rodgers Omuya korwasi nyagitari ya Kisii Teaching and Referral Hospital to kwanira iguru ya our mental well-being and sometimes mental illness ekroto kwanira umuchando kwibirengereria bingi gwichurana kwibirengererio na ko depression ngomota ya murenga umuntu lebo kawaida waikatwale stress ati kuna mtu ataishi bila stress ngayani ule daktari huna stress bona lende kerombwate stress na depression kindanye tuwale it's okay to have depression because rende kusenarengereri.
Ntubwate normal stresses, normal stressors. Actually, as a definition ya mental health, a person with good mental health is someone who can cope with normal stresses of their life. Igo omuntu kunyara go cope na normal stresses. Igo ntubwate normal stress. Kwarire ntubwate normal stress, but normal stress yekraya kwasi nyirukonye control, then that's when a mental illness starts coming in. Wasini go control the stress iputote bere rutonyo retindagira maragoba umuntu nabakunyara go control stress retinya retindagira lakini nabonkwenda nkwane no muntu gete kusina bonkoro nkorigenchira yende nyori endagira survive mambi. Nandi naro kago chaka konyora ndagerete yo nyomba aidari ngori usakole gento getekere bizea usinyiru ko cope with the normal stresses of life kwarorire ibono ya chire into mental illness normal stress ninki turatebe normal stress stress cha kawaida buna financial small financial issues relationship issues kira mwa wasanire na your partner kunyara ko communicate mwa ibwanana kiro bwate financial issues no bwate emotion intelligence kusi no bwate nchira yo solve your financial issues kutatika kutumia chinchira chinde chira ko hamu kusa chihamwe society ebina bye bintu tokoligereri but kera bono ya chire into depression oyo no muntu otemire ko cope na normal stresses mpaka interfere ne chemical cha chobongo imbalance eri chemical chobongo bono ne correct depression as depression inkonyora tore chemical ke koro kubuna serotonin kere implicated serotonin levels chiko gendanse serotonin is the like it is a feel good hormone nere hormone ko monto over or feel contented or alivia but kira ya chirense monto bana ucha ko present na very sad mood na kiki kira to ko ero monta maliogo yo ko boost chi chemical ke ko serotonin utaona mtu after some time ameanza kurudi vizuri
Pia mwana sana daktari ndoje chia SMS chiko na wocha igana takumenya gose na tomerwe a link so that I can share it with you my producer baba Ven abago share wocha iga so that intumere daktari nera share na abantu baye baligirira mu rubuli bono mambia nara iga omboli otebanga Joshua Monguru Ishmael kora nyatie ko milimani kinyozi agoteba narigiritie murubulio otebirenga mental illness depression nkurwali kwa ere alafu munyagitari is it advisable in such of mental illness to see umuganga can it help oyoboli ya maboli abere ditangani
is it treatable?
Is it curable? Treatable. Number 2, I advise ya ono na cura motebie aratagwanda kulikia muganga. Mwanga na yaro munyanabi. Yes, Joshua Monguru.
Mwoli ya maswali ya maya sana, especially li swali li ya kabeli yo munyanabi.
Munyanabi,
Mtobwato mchando sana segusi ito, accessory ya the myths and the misconception.
Yes.
Kira monto ndebwensi ya present na symptoms cha mental illness, etokolengere li umuntu ya arogwa. Warorire. Bachaka kumwira somo munyanabi, baruoro bamwira se kanisa. Kira abaire was kabisa nari bakomoreta nyagitari. Onege ntonda atabyo murigerero itoto rigerere tukuru milimani kinyozi ateba. Mental illness no boroire buna bonde bwensi. Depression no boroire bonde bwensi. Na ndembo bwate treatment. The earlier koreto morore nyagitari the better. Igo depression into bwate duration ya treatment. Mono into bwate levels of depression. Into bwate mild, moderate and severe depression. Into bwate virenga elie bike ebirega alafu ebinge kabisa elie wenta kwa admitted nyagitari. Kiro monta bwate mild depression. Mario wata yotoko mwa. Montolio chakire virenga elie yake. Chakiri gutwara chisimbutomu buna toronchiri ko chabia mood ya depressed most of the time continuous for 2 weeks aga chirita sa sogeti chakiri gutwara feelings of hopelessness kwarorire oyu aguchaka na counseling services na anda akugwena bwangatara chikoika bono the second was that third phase ya depression oyo what moderate depression nguchaka tura maliogo plus counseling oyo what severe depression maliogo litangani toko muchakia maliogo pakaira nange kerera nirange tumanya guchaka counseling if depression is treatable most mental illnesses are treatable but some are chronic eminenti na maruira atali kugwena umuntu ago dependia sama maliogo buno muntu bwate sukari usa hypertension lazima anywe liogo kera lituko mona so uburore bwa mental illness tokoroka buna schizophrenia useboli abange bakoroka buno bubalimo oburazi mu muntu on treatment continuous
pia mona sana asokorele Joshua Monguru Ishmael kwa chinsa machichanya tieko milimani kinyozi inga depression is curable ekero wachire mapema but narore nebwate levels mild depression moderate and severe ego muntu taganya eke severe but how do I know that this is really depression?
Actually most of togoteba when someone has a mental illness it is the brain that is sick obongo na bogo de sifa bwamanya umuntu narwarite lakini kero bongo burwarite umuntu monotari kumanya gusina narwarite but yaso umuntu wate mild depression na bakunyara kumanyana ki tindi buya lakini kera kire severe umuntu uri no moto inarwarite tawanja akobata injembu yande ngiyo tari kwisibera imbu yande ngiyo tari kubokera injembu yande kwararire because tabwati gendo tokoroka insight obongo bwa rwarire kabisa chikemiko chiri cha imbalance ya chire igoro muntu utakonyara bono relatives ni moko notice this person ochakire ko neglect personal hygiene tari korara bia ochakire ku lose weight bunata alenge usomentire chikiro bunata alenge kwararire tokuchaka kuligereri ebimanyereri ntubona relatives bono ni tokumwira nyagitari nonye nyagitari ntubwate gendo tokoroka involuntary admission to a psychiatric hospital egere esesa uri muntu utakunyara ku make decision yare gweka obongo bone burwarite family nere ko make a decision yo ko admit form chire bago cha basa in for involuntary admission murero abonyora treatment ga kuwena bono na litoko mokwane lero monyene omanyamo chando kiabwate next time kirago che clinic yagocha erebweka voluntarily akoirete erebweka nyagitari.
All right. Naro likobulji boli nate te uchakoboli nga kyoko manya what is the difference between muntu le depressed ga kwa nyagitari nolia osibire chingoli nolia osibire chingoli na vera ben depression yaba too much gosoli it's a disorder or your depression na bagwe tali weka nyagitari gosega akole tunere with that rineri
bolyo ligia umuntu gocho sibire chingoli nyagitari ntori goteba muntu depression mono tali mbali kwa violent gosa aggressive mostly they are low kera symptom chaba actually depression means low mood activity chabe chire low their energy actually they have reduced the energy kiregente kirense ngomba bwati nguru chokurwana but kirese depression ya bere severe obongo bwatemiro kurwana bwasinyiru umuntu nabakuru agutorega ntokoroka depressive psychosis warorire umuntu olenge low kabisa bono in the process yo natebe tumubire ngutemuri kurwana uburwere bweka in the process yo bongo kurwana uburwere boli yo produce some other chemicals umuntu bano tan energetic or very aggressive utwara depressive psychosis iga abantu bali bagutwara depression ya very severe yareta psychosis but mostly abantu bagocha basibire chingoli depression is also a mental illness ikine ke abantu betotente bamanya is a mental illness there are other mental illness abantu bagocha kibasibire chingoli na ignorant to discourage to sibo muntu chingoli we use other means unebitamba ibintu bitaba umize ntubwata other conditions umuntu arasibu chingoli chikoro kubona psychotic conditions psychotic conditions nechiri chikogaro umuntu lose touch with the reality warorire in depression mostly people don't lose touch with the reality na ba understand the surrounding yae but in psychosis mostly people don't understand the surrounding they're in a different world they are talking with bagukwana nabantu gete batali in existence ebintu biri batogota bagutora false beliefs agoteba nabekere microchip bongo bwayeme como monitor asagutara abantu ebayiwete gentare ngarati amalioginari yabanta agenda takonya kugamba naro imutaiweti mokwanira era na maliogia mangaga ndata kuiraneri kwaro ichine itokoroka psychotic disorders but depressive disorders mostly abantu understand the surrounding yabo but because of the low serotonin levels mbabo ati motivation because serotonin gives us motivation mbabo ati motivation iliyo gukora ibintu biri bya bale gukora bya kawaida
all right pia mono sana manchi muligereria timanyeti gosugikira bunogenderete gwesomia birata tukurwa sumye gitari tutubata studio tonde tukwanira about our mental health yons kwa jumla because everybody must be wekatu ale mental health ere normal wanekero ya salikire
kuna kwa
mental illness kerwantu kwadira umuchando bwibirangere binge noro depression to kwanire gocha but I was wondering depression igere yemo kose nere types of depression kose is it general depression elinda atware nero oranyama ko tiabwate gose Thomas gose ekiro muntu nabagotwara depression yaye.
Depression into what actually different types of depression.
Yes.
Into what depression yako basa abana. Into what depression yako ku persistent depressive disorder. Abantu bali babwate depression ndio kalioka gose serietalia medical tamwe ko ku cyclothymic disorder. Into what depression ya bipolar. Abantu bali babwate mood disorders.
Oh yeah, sure.
Mood kirata kwata bipolar iminetiere mara kabere. Bipolar 1 omontale very happy. Extremely happy, increased energy, okole bintu lakini kira yabere bipolar 2 bono is bipolar depression. Ibono yun depression yenga ekole group y'abantu abangao mono monto bwate bipolar depression lazima na bwate bipolar 1. Parolire nigwe china tofauti chiri cha depression apart from kubeka depression in levels ndo bwate different types of depression. Actually ndo bwate yende korokubuna premenstrual depression disorder ekoba saba subati liri bago konyora their monthly periods mbali bago twara depression yeyo kirago chikuikirange abo chaka gutwara ebirengereri abo chaka kuba mudi irritable ako gachugo gwango. That's another type of depression. You throw chibone specific in women teri koliba basacha.
All right. Bia mwana sana daktari naragi goteba ole mekenye HC agoteba good morning from Narok na to watete kabisa nara kwa Daniel Disini amweresa goteba what about those who kills the children and himself. Hata vile mwandararo goita bana I think sasa ndio ameingia
umeongelelea hiyo.
Yes.
Na ni vizuri pia ameuliza kama hajasikia abantu mbali bagotwara depression barora tinkonyara gotiga family yana seme chando because tawata bakiro monta ikira abere suicidal.
Yes.
And the depression is the leading cause of suicide.
Yes, sure.
Kiro monta ikira abere suicidal you go lose the hope. Kwarori na ndorori rumuntu tayora nyare komo tegerera.
Yes.
Bono kire go akoronya abantu abangira bontegerera kamba tegerera abana bane. So that's why you find especially most mothers.
Yes.
Tali raisi musachoreka go koraiga korere na basacha abangi bakwibisa. Bagenda balike noti bakoraigo. Yeah, but chikesi nyinge twarero monta ko involve abana it's women.
Yes.
Yeah.
All right. Bia mono sana daktari aso twerera mangi gro ya mental health. Kubuli nare genga ngaki ngokora manye monto yobono level ya depression ya chira tambuse na kinko manyango monto yo men na bwato muchando depression. Depression ne bwate bimanyereri bya esara nandeke manyereri gatangania tokoteba buno monta gutwara a depressed mood. Yes.
Use low mood most of the day.
Yes.
Continuous for 2 weeks. Igekende yonskere below 2 weeks that's not depression. Anything below 2 weeks na botokonyero acute stress disorder use some form of stress. So lazima montatware a low mood most of the time every day.
Yes.
For 2 weeks. Yani chinsa chinyinga seri tuko continuous as wiki ibere.
Yes.
Eke manyerero ya kabere no gutwara sleep disturbance. Kwarorire.
Yes.
Aida kurara mono usitari kurara nonye. Eka manyerero kende kya gatato loss of interest ya sevinto montanchite gukora. Bono for example Sara buna anchite gochega sia gotambe na bewe kasegete kwabuka mambi ngwambo linki nanyorero tokumanya gosenaga depression yombwate watebi ngende goseti ngenda juu sasa nini yako imeanza kuchange umeanza ku lose interest na vitu mingi. Bono ningende studio gali na gochinkie gankonye ningende gasie yu inkie gankonyete warorire interest yachaka kuchange yachaka kuira nanse kabisa umuntu ikamba kabono nonye ni gastari kogenda otiga ose bintu biri anchite gukora otiga gukora kabisa. Again tokende engaging themselves in risk behaviors.
Yes.
Umuntu tare konyumaru usore konywa maru moderately ochaka konywa maru bobe pi risk behavior buna risk sexual behaviors ana bagutambuka ipara tari kurigereri buno omuntu agwente because ebirengereri byayebire chebono I have nothing in this life. Kemanyiro kende is a hopelessness. Umuntu chaka gutwara hopelessness. Onyo bwate chi plan cyako chimutu oni gatabwate any plan. Amenyete for the moment. Ochaka gutwara feelings of guilt na worthlessness. Guilt no way chaya gusogo blame. Ayo mwenyene wachaka wichaya kwarra
chaka wichaya weitia.
Lama wasonga korete weitia. Naragere tengwetira mangana igonsi. Alafu bavolo muntu ngotwara loss impaired functioning. Pose productivity ya yera nanse no nyene ka sia bantu no baguchaka korora Rodgers study productive buna alinge korukale. So those are some of the signs and symptoms yo muntu bonta kolegere into what actually weight changes into what change in appetite bale bakuragira mono bale batali kuragira bale bako add weight bale bako lose weight kila what depression. So it depends with an individual no ni story to ate bale bakurara bale batali kurara no
right. So omuntu isokorole binte bya somonto na bagwenerete amubolie even atakazini umete muntu narogoche gazi kwanyora akirete injiragete goso smile fake smile tanto mandra chagwe komerere go smile lakini inside abwate obokongo.
I actually nabokora umuntu bwate fake smile gyagara no manye to muntu to mwara bakora na erega sara nabongo chamambie sasa uri ko bakwani smile kiro muntu batikingo so asobisiane. I'm very silent ko wochonyo ren umunta arotu atuliete tinza chinda actually nabokurangira umuntu marakabere sara
aski
ayuko akombali omanya gotabubuka wararire igokera kwarorire bimanyereri ebya so muntu tema sana gokonya umuntu yo atarachikogende living now
imanyereri binabire general wose abasacha mbiro bire binga kena basubati binga ke usabana
usually in depression ebimanyereri ebibwekaine the presenting symptoms echibwekaine but ya sabana ntobwate etofauti yake kagara bana bange mbali konyara gukwana kose ko express mono abana libagalia depressed mood bagutora ndo tokoroka irritable mood kunya kolera lioka koga chigulioka mono ase mood yabana ekine kyokorora nanda abana mono chitore chikobora compared na abantu abanene abandi bako bagusekera nyumba barara most of the time.
Ngakirende turakonya abantu bari tutareka na kitoko bakonya daktari igo obumaene abantu mbabwato muchando yo no kusiye to metara kage we are talking something in happening in the country
umuchando bwe birengereri go depression no already the leading among mental illnesses.
Yes,
it is the leading cause of mental illnesses in Kenya. Boni gauna tukwana depression is number 1. Yabwati ku number 2 na anxiety disorders. Mood disorders bono chama ne gochaka uchilitwa kwa na bipolar 1. But the leading mental illness in Kenya is depression. Buna boni gatoko kwana.
So in this career abantu bagwikera abange, is it men or women, and how do you handle them? Umuntu for example what a severe depression oikire nyagitali ole through kayugo chakira mpaka umuntu ya chabe kujia because finally at the end of the day it's curable but you're children are severe. How do you even begin? Where do you begin from? Medication and treatment.
Depression buna whatever nere common lakini abantu bago seek help mapema na basubati. Actually women present with the bago chenegitali kiraba mild to moderate depression. Men bago chekiraba very severe depression.
They start
very severe depression and that were accompanied no muidi kwarorire nande gawe bamuforce kabisa convincing yasinya yabidi bamuforce bamutegono to ndenya gitali tata turi kobera nyumba ga nyumba ngo sikatori to ndenya gitali bono mkwane lego ya treatment process umuntu ochire with severe depression. So the first thing we do we start the patient on treatment yokomo kokora bongo wa relax. Usually we give them yoko bakora barare yoko relax yo bongegere kiro montara ire birengere lingo pungwa birake after lirio morwera rere we do family therapy kiagare family nere guchikobera na barabo gutigara turi ne family to abakwanira ba understand what the relative is going through oyo omorwero yo muchando kiabwate and how long is it going to respond. Actually gentonte denta bya baligere libaito mental illnesses take time to respond kuira chireka correspond to medication. Na kiekyo to kwero monto obere wiki ya monki morwero na tarabera bia. Actually kira to abekiro morwero na antidepressants gotekiere 2 to 3 weeks kwa manya guchaka korra the real change umurero chakire go change amalio gali toko mu amatanga ni nali yokogera yo go treat symptoms onye tali kurara uchaka kurara but amalio gali yako kolega asubya bona balance chemical chobongo gotekiere time at least 2 to 3 weeks monto manya guchaka mboli ko baba no buna malaria monto 3 days onyura malio go tigire the least period of time to already depression is 6 months. Continuous medication. It's a journey. 6 months narrow the least duration you can maliogo monto what a depression. And after 6 months there's a way to chaka go withdraw maliogo tali buna umuntu agotiga ne painkiller otiga kwenye. There is because these drugs work on the brain na kende kan sikia kolega asia sobongo when you remove it suddenly it brings withdrawal symptoms. Pone nchela nere toko chaka kwereni dosi ya maliogo ngora ngora toke stoko tumali tuko to chaka kutumama tukabere ngora ngora tokorusie yogo liliororo. But imbale bako and on treatment for depression for even 10 years. More than 6 months. Depending on the support they get from the family. Sara butambe na kwande goro ya family psychosocial support. Abarwele babwate actually strong family psychosocial support respond very well to medication. Very well. Never mental illness yere na ki. Never monte to amurusi ase street yo very rare miaka 20. To amucha ki treatment. Kogichanya ora supportive family. This person is going to respond very fast to treatment. Compared no oli to kwa maliogo aicha ndetera bweka uirigeri endagera nsanga pingo chikonywa maliogo kinkonywa maliogo yantara aragira nkorosa rero tiganda atiga because those are some of the side effects ya maliogo ali to a depression ya bwate omoroso na okurara mono chinsa chinde ase igo family psychosocial support plays a very big role as a recovery y'abantu babwate depression igo kera to abarwaliri to amubekira oralire to amuchakiri ntobwate medication in form of injections ntobwate medication in form of chindetero montakonyu ntobwate mbaka syrup cia sabana igo nkumubeka tora samalio gaya kira agwenire bona achakire go changa toregento tokoroka insight no kumanya nindwalete depression nimbwanto konywa maliogo gweyanchirana ne gwancha bone umuchando ulio bwate bono litoko ikaransanira to amweresera na kia bwanto konywa maliogo aya na kia bwanto go check clinic usually they come to clinic only kero to amotishaji after 2 weeks and then 20 increase duration yo chaka go after every month mpaka twara robere buya kabisa.
All right. Bia mana sana. Is there a scenario montatara correspond which say amaroira ya chi antidepressants yes. Is there a scenario amarioga arange correspond pi?
Me Sara scenario sinchiroro rongo twara turege ntugekoro kubuna treatment failure.
Yes.
Umurero chakabuyo kasegete nani symptom chiricherana the what treatment failure but kila to atore treatment failure we have other forms of treatment especially for depression to what again to get korokubuna ECT ECT in fully immunity electroconvulsive therapy electroconvulsive therapy is a form of electric therapy ekokoru in theater monta kwendo bekero lyogo lyokorara alafu obekerwe shock ya sobongo bwae it's like an electric shock something just run for 2 seconds kobe both on the sides of the brain ya to me shock which sobongo and then the way the ECT works work with antidepressant kabisa na ande yakokorega sibu yakobwa no nyina maliogo and it has less side effects the problem we don't start with ECT comes as a last resort kera to atemira maliogo ya failure alitogocha twa tumia ECT
right it isn't risky.
It's actually it's safe even for pregnant mothers. It is the safest for even mothers who are pregnant inyaro to gutumia mono gukorera treatment ya sabantu babwate treatment failure depression gose treatment failure mood disorders kera kwa mwira malioga alions p first line second line failure na litokoreta ECT. It is not risky karekera ECT abete discovered na lia renge risky because mba maite gose omuntu na nkobetware liogo likoro kwe muscle relaxant gose liogo lilio korara so they used bari gocha babatalero moroire bamunantia segetanda bamusiba kabisa kegere kire esho kire gutuma omuntu akobona omuntu okumagaka so in the process kira yare gokorwa abantu bari gutwara muscle tears fractures omuntu otwara dental problems but bono discovery kira anesthesia abete involved omuntu akobe lio babunariria tia torara kabisa obekero ne muscle relaxant noro ECT eri ne tolikorra umurwira ari calm tolikorra guse yetire but kira babokire umurwira ari buya kabisa.
All right. Natural remedy neroro omuntu onyale ngwangira correspond even to those things because nabe kunyalikana nchira nero arakonyu gutotumika mariogo bono osonya mwatumikira mariogo mwatemire but just idea do we have any natural remedy?
Again the tobwate sara is a preventive and protective measures omuntara teki but in tobwate datebe after treatment failure duranyora nandigen tokende but butambe treatment ya depression ebwate ebintu bitatu tobwate biological psychological social spiritual as biological no amalioga gochera psychological no counseling yokorwa social ni into family ne society spiritual bono na lie kanise gochaime ase kitoko bekera spiritual usually kera kwa kolire no morere ko runyagitari kera kwa motomire go che society na bwento go belong to a group either a church or any group amaite abantu mbalenda agende tuikaranse tukwane na barabu kwarorire actually before psychologist came kiagara no nyembo no tora psychologist baisaine abarwira bange bale gokonyu na ba pastor gusaba sasiroti kiro mwaroriro umuntu nabwate birangarie binge mwaka mwirire aso umuntu bwekaniso tema kumukwanira na kumusabira so preventive factors tobwate nkwanire preventive na kitora umuntu aranyara gutanga tanyara depression preventive factor intanga is knowing about depression okumanya depression ninki getting information about these conditions kira kwa manyire kero chikorera ka symptom nonye na kamo na gokunyara goikonya mapema egento gya kabiri is eating right kiagara diet embe nero na beko gero muntu atware amaruire yake bonga wao depression included egento kende no go seek continuous checkups to rule out any underlying chronic medical conditions kiagara toganya onyore oguchakwa diagnosed cancer kere 4th stage warorire igaho go so into depression yere bwango sana another preventive factors is maybe in communication in our relationships umuntu nabwente komanya kero so into a relationship na benge kwasoira ase a war zone anything can happen to basiko so atibono na mapenzi menaswa like we prepare ourselves for any outcome in a relationship
eventuality
nabo turagendera gusina baira ere nabo turarwane gatiga iga nabo turawomane and again ogotwara financial management skills squeezing kwa bantu ngo genda bali mpaka se classes omuntu somiguna kya kunyara
na kya kurende
living within our means yekeruta konya goteba we must live within our means iko ekina kigendo kende kiranyara ko prevent to twara mechando kyagara talinga kiri kwanyore chinyinge watumia bobe kabisa warorire ndo wande twamanyana ki umuntu okunyara ku manage your finances ndiche chikoletere a problem another thing kumenya bune family tobasa ko itenga ne family atibono banta abanje nabere uyatimba tageti abuna wabantu ka bara ikasegete bakokonyekera gwatwarira umuchando those are some of the preventive measures umuntu aranyara ko bakagoteka
right biamana sana mwanchumo ligerere bwetaya TV togenda tukwanira chando pui pirengere pia beire binge anto squeeze mbaruarete naende continuous check up ne konye sana todu no munyagitari akoro kwa Rodgers Omuya korwa Kisi Teaching and Referral Hospital mangana yonsi pia ukwana anaya manyeti kiagera no nyambono manyeti akimaliza ataenda bado pia yako
anaenda kusaidia wagonjwa
anaenda kusaidia wagonjwa nintagete kumanyanga talimo goko inokorora these people all the time gosimo koleteru abaruira banga banginya gitari what are you doing as a department? To me, I feel your department is quite independent because you deal n'abantu babwato chando kwibirengererio is not something na malaria or antome elab whatever it's malaria positive mbetu sindani ngekunichindetere within a short time na wenire whatever it's a journey 6 months it's minimum. You go maximum, it will go up to 10 years. So it means no it's not something easy. What are you doing so that make this sector at least engorora because taliento kirera isibuna na require
Biamono sana Sarah.
Yes.
Actually, the mental health department is one of the busiest departments. It is less funded.
Yeah.
It is neglected.
Yes.
Ekutumika na politicians yenga kie campaign.
Yes.
Ndositoko nyabantu baito mbako baiga. But after basore into power, again ebintu bikora na into normal buna biarenge. So what we are trying to do, we are trying to subdevolve torochi already health devolved, lakini bono into our sub counties. We are trying to start clinics in the sub counties to identify ebintu bimapema using community health promoters n'abantu bali actually kwenye training ile tobwate yo train community health promoters HTS abantu bakora HIV testing and counseling igoro ya identify mental health conditions in a partnership with the LVCT twara training ya abantu abange alafu boni ganto bwate chi committee kera sub county tobwate monto tenere mental health kera sub county kuchakira nduru oche ugembo kira asinto bwate foko mental health person yotenerete amangana mental health na ndento bwate referral directory ndo bwate directory etomire kere sub county baka mali se dispensary agara kere nasi ore se dispensary aroliro moroire na bwata mental problem enamba nerebe kira asura nyore specialist ya mental health asura mutome erangene ne dispensary ya within that sub county anyara ko bakago konyu agara ke kusonyo kurugali na liara tumgocha Kisi referral hospital ige directory actually LVCT ya printed so many copies onangana chene ya motoshe but it is in our facilities nere KTRH nere kere facility asura nyore namba yo munyagitari ore specialist ya mental health uranyare kwa kere simien time mukwane nere agota inka yora monyore uso uri okorifa enamba kwa kate bo murero yonare naiga nonya atarachiko kanyagitari na botoko motei korege keneke utara morifa gocha so we are trying also working with the partners una baby non-government organizations, non-profit making organization, community-based organization. Unaboni ganto bwate next month it is a mental health awareness month. We are planning to have so many things. Na lento bali getavuneta ya TV tokolega sinaino. We are going to have free mental health camp. Go screen abantu baito for mental health issues. Mbona tutaranyore venue kai but towards the end of May ikina kitogo chikokora. But the first few weeks botambe ganda tokora is screening our staff. Mono nkobe katore attend KTRH twabeke attend at the county government offices to screen abakollegas. The last screening to akolete abakollegas we serikali abange babwate mechando.
Achande getamanga. Ichiloni
abanyari. But I'm happy to achagete clinic kia staffs
okay
amenity KTRH esibagocha bakonyora omuntu tari necessary rinchenda bero enye gitari nkohayera omuntu a private psychologist yogochobera ororo egaro bakwanira kiagara most nonye ninche nindwara tutebe na rwara mental problem because of the stigma I will go actually out of mono korunya gitari piori gyo omuntu renya gitari ngao akorore kiagara still as much as tokotebe as health workers we should have ethics and we should keep patients information very confidential utwara turi abantu bakweba benda bayikaransa sebikao achaka batebo maitero just squeeze about depression kwarorire ibina bintu tokobwa kwanyora bakenya gitari ga decide bono tigatobeke clinic amenity gya staffs nandikire mandi no muntu otari gukora okurangirwa gukora iskocho barara ogenda.
No, that's okay. Because privacy, confidentiality.
You actually it plays a very big role as okuwena kwa muntu. Kiagaro sikosoka guchigari wegento watebyo munyagitari nandike
yasoke. It will be Do you always follow up with your patients? Because I mean, and Bonoiga, I know you are playing a very big role as a client. Do you always follow up? Because once watch requamo check gitari, that's the end of it all.
Okay. Biamano sana siriboli eliosara. Actually in psychiatry, follow up is a must. Follow up is a must. Yani ntundu rikorwali murwerere arotairana for the second review. Na kio owochera every Wednesday ngutwala tore clinic ya psychiatric KTRH buna mambi. You will see so many patients. Actually the minimum oranyore is 200 patients.
Wow.
Yeah. In a Wednesday. 200 patients bagocha for review and check-up. So our patients are on continuous follow-up.
Okay.
Kirabatali gocha ntobwate medical social workers togotoma kegaran ko batore ntobwate a director ntobwate gitabu stokoli ko morwere ne namba yabo yesimu kiregento tokoro mutinyo taracha mutinyo ndetaracha we have to follow up tomanye inkikiabe to morwero ya taracha clinic because omorore nabaira ako ikarre na gwenire kwarorire atiga malio ga senchererie tali advised una tunago tayenchera ne to tiga malio again enjoy good health 1 month 2 months the third month ya atware ngendo tokoro ke relapse so really bolibo kwera na in a very big way polio bobe ko bwa buna ndiri bwa renge na kiye kitoko bekira borero baiton continuous follow up and you know these medications are poison kiro monta kunya malio ga yango chabale twa kora checkups chabo twa liver ya bombiere kidney mbu ya chire go sama malio ga ya trend side effects so kora there is any reaction with this medication agara twa chenchi amalio go twa malio ga haranya go tolerate so the essence of follow up as psychiatric patients no common progress yabo o common malio go abo dossier to commenta use to kwira nisi na common side effects chukuru asama leko because most of these medication una na gotebi they have adverse side effects na ndo utaliga retima pema morera go ikanga maliogo pi atebe maliogo ali moko ngana ara ko gara na ruara mu
pia mana sana daktari in chebuno muliki I become very happy onye na feature a certain story na endo mondoli okonyirwe osonyori robo konyi because we highlight so that you monto you akonyeka at the end of it all you feel great so tumanye thinga as a psychologist koligilia ndaba what depression especially depression is there any successful case or whatever kegero kina bwati chumuriro yone mpaka kabwena you can even call him or call them mwara tuara cup of coffee what the daktari lakini ulinisaidia akiwalai so you feel good because tole say when you do something good you impact somebody's life you are a hero
yeah sana Sarah actually I have several successful stories several successful stories and I usually thank God for the treatment successes chirinarolire among the patients na arwalire I remember the first time kirana atometo Ogembo Gucha sub-county hospital Gochaki psychiatric clinic I targeted one person from the street and I really hope one day no more invite you studio
is my home.
Ndori gokwana lietali omurwaire.
Yes,
but there's
sure.
a guy who used to kobera court yokolia mangana mange sana ogembo law courts. So that's the person we targeted for treatment the first time. When I robere court yemiake menge sana.
Ulio wana songo kabisa. It was a learned guy. Ulikuwa kachianga chia basubati.
Oh. Togenda monegera abantu
bamanye.
Is a success story.
Aki.
Kirana chagetie clinic kiano gembo gya psychiatry. Actually na rogarete the psychiatry clinic ya Bucha sub county hospital ya Kina. Gira abantu barorete ati kumbe omuntu na bako kwena. He is not the only one. There are other two ladies to Ruseti Ase Street Yogembo. Even up to now Omujamoyo Oyukwakwana, he even comes to Ktrh to greet me. They usually come with the wife. He's doing very well.
Wow.
I think it's now 4 years down the line.
In fact, look for him so that I can host him.
I will. I have the number. Tunaongeanga hata kwa simu. The guy is doing very well. Sasa amerudi nyumbani. Juu nakumbuka the first few months alikosa kwa street, watu walidhani amekufa. But after sasa wameona anakujanga Ugembo clinic, anachukua madawa, anaenda nyumbani, then people walikuwa wanauliza nini ilifanyika hadi mtu akapona. So those are some of the success stories zenye tunashukuru Mungu alitutumia ndio mtu akakuwa vizuri. Yeah. Another success story, I know you know the guy mwenye sometimes back ulimuhoji. And he's actually doing very well. He comes to our events. Yeye ndio tunatumia kama ambassador. Kwa tayaba ndo urere bwo bongo nko wene kabure kiro munta ayanchire nimba to muchando yunandi lazima anywa maliogo. Is another boy who is doing very well. Anafanya vitu zake ako vizuri. Kira maliogo isire kwa lazima ngakire simyante ya maliogo na isire kwa era ngo chande clinic. Doing very well. Amanyete liogere na lili kwa nkonya. And so many other successful stories. Mbake china achitenche nkanyora. Like I have people who've been coming to clinic since the 80s. Baka boni gaguche clinic. Nchinaona monyorete. The person is doing very well. Tanya kutwara any problem. Na chamwe karansena ile to wancha na bwa mental problem. But he knows kirago chukutwara muchando ina kiako yu.
Wow.
Yeah.
I must recommend you so much.
Thank you.
When you take around your monta, we appreciate whatever you are doing. Amondra takwa bese. Okumanyango montona sigeti okora. And I wonder, I got to go to these public holidays to identify the heroes and the heroines. Why is your names not in that list? Because for Christ's sake, Ochencho monto olio bonko to abange to boroka da chibalimo abande to boroka monto bata depression yubo no talimonto ocha kobeko monto yu brengel bia yu obi package all together bicha kerende ko reason bono bija bono moko gamba. It's not a joke. It's a calling, by the way.
It's not a joke. And we usually thank God. Nyasa itoko tembia mono. Kiagara without God, aina boko na nama kiagara potambe toko te abentu gasi abanyagitari no kurwali. Sasa ina roko gweni.
Mungu ndiye
anaponya. So sisi ni kupeana tunapeana madawa, Mungu anafanya kazi yake. So omo nchemonto na tanga appreciate. Also on the ones I appreciate because sometimes me I feel like telling me thank you every time it's like you are inflating my ego kiburi. So what I usually say kiumorera goteviria asante kabosabire sinya sai that's enough. For if you are waiting for your work or the government to appreciate you, it's going to take centuries. Government appreciate people very close na barabo. They are friends, they are partners.
But if I have you.
But now, that's what happens.
But Rende Kubali, you are a hero, and I must recommend you. Even bringing you here so that you can share experience that one alone, really because kiro monto Not necessarily you directly, but indirectly in one way. So na tugenda tukwana magana maya mange. I'm happy ngagendererie gasi eyo. At the end of the day ninkubulinga nkioroche what's supposed to be done. Maithana ne radio na boko nyebugi kwe unge ya korora bono. Uisoko nyonjole nchiragethega kwa nyorenge sauti, it is now clear. Yote mine tingere netike kuvuga but na boko tune mpaka kwa nyora the clear tune. Kiwenerete gokorwa so that you can continue serving the people. Ayungo chetororo. Nara igolikire ujumba goteba halo etaya. Mbona hata mtoto mdogo pia anakuwa na stress? Ila mekia ndoto kumanyanga yani. Sasa Bible nditokuriye fees. Nditokuriye ndagera abana bake stress ni ya nini?
So tikabona nte bila meki.
Yes.
Ntwakuwa na mpaka abana bake ngotwara bare depression, abana bake ngo attempt bare suicide, abana bake mbale virus ba rule say sorry ya suicide na depression. Igonto what depression ya abana bake. Actually as young as 5 years ntwata abana bagotwara depression. Na ndi ninkige kogera abana batwara depression.
Yes, no, that's the point.
Ntwakwa nege ntuge kurukubuna ayina boro chengwa kanore school fees. But are you there for your children?
Okay.
Again, to go to and functional families. Abo buna baika nyomba igali bakaba gukwana umusacha gukwana ni nomuga na mukaye bakwana ni nechi nkundi mbele ya watoto bako so abachakana esegi direct koso musacho chakatindete again tege tangania go ikana abana go chaka kuwaka chiteye nyomba kuchaka abana chaka abana kirase. That's one cause of depression among children. Ayoka go mwana is young, is 3 years, is not getting anything, lakini mwana oyo actually emyaka ye monomono emyaka ya 3 4 5 years nali abana bago take in a lot nali bago capture binte bingi igali nali mwana character ya yako build emyaka eri nali akora ranki mama akora na rwe kwa rocha akakora buna mama ngitata akora rocha akakora buna tata ngorole mbako mwana ngo ikare kiratato mwabako musesigara na roga ndoro sirisakara ochaka kumusabune sigara. That's the age abana bakurani ebinte bingi and they take in a lot. Ebintu bago take in a lot na bikora tegendo tokoroka advanced childhood traumas. Osa advanced childhood experiences. These advanced childhood experiences na chiko predispose ya mwana oikatine juhudio chakakoba nimichande mengi. Kiagare bintu biri if we don't tackle childhood traumas kuruga alibuna yachaka obana bangu chabale gutwara imichando. I can give you an example. Kero mwana asiriri omuiboli omwana omoke they really need a lot of help and counseling at that time. Kusto mwana tanya korra any bad disaster ke happen, any natural disaster. Trauma chirina chiko kero mwana otwara depression. So commonly it's non-functional families. Kuso kwero mwana oge boarding school ayo akanete school fees buno akanete mwana ochanko kotebi nje mama tinta get kogenda school weli. Kama tenga akanete school fees on tinta get kogenda school. You don't want to listen to this child yomanya nkiako kukanile school. Do you know we have abana baito bako ba recruited into lesbianism, gayism, kirabale school. Lakini buna ayo muiboli oko itomo mura kabisa kwa mateirazi mwira ne school
yo. Lazima ande shule. Tutaiti kumanya the root
mwana kwa so very sodomized because we are having even abana bako ba defiled na teachers because even staff says ba soma.
Yes, even from the very parents.
Mbone gentonda atabilamek. Kira kwa rero mwana wa atore depression. Sit down with this child. The coach will dismiss it ya no mwana mokenka yebirangara libikoro. And it what about depression usually it is the risk factors are multifactorial. There are so many. We go play yo monto manya gotwara depression.
Alright.
Ikaransa no mwana oyo nse motegarere manyamu chandu kya bwate. Actually kira sorry to depression bono no ina no mwibuli tako gotegarera.
Okay.
Kwanya uru mwana ikire myaka getosoire into substance and drug abuse. Kwarorire. And then tubata abana bande bayiboire with some conditions abayoli batari konyara we identify. Abana bale bagotwara mu chando guna attention deficit hyperactive disorder ADHD. Omwana ale hyper. Onye ochaga ye studio tachire mesago roga ye osuguna nirese kamera eri ali kirase. Lakini buno muiboli aine biranyo byokogenda tukumuita. You are traumatizing this child, you are hurting this child. Na kike twa buna kwa boli mpinto kitobwenta kokora. We are actually planning to start gusomia abarimu mono mono kurusega iga umwarimu nyara ku identify umwana uyu nabwato muchando gwete ntubwato muchando bwa autism autism spectrum disorder abana buna abamba bari at risk yo kana depression kubwa abana normal generation ababale normally we have some underlying condition chiko garo umwana mukotora depression we have environmental factors family issues we have even psychological issues chiko chanda abana mono mono tigato dismiss yo mwana kera achire ne complaint kete tigato manya inki umwana ya a complain eliga ura motegerera litana.
Thank you so much daktari asuko tumanyanga nona abana bakengo twara bale depression lameke okumirisana ngo umwana moketa ebintu biri actions chirito gukora nyumba na Bible the surrounding the society mwana ntebi amekuwa raped ama defiled. That's the same
for example Sara bwana tigango ta example yakemo inwe nyumba kiramo ikire nyumba mono mono no create yo waba go chasa abana muri kurwana muri konyumaru but kimwe karansira mesa ali bagali ko discuss no nyene lingana lya nyasaye mo guchaka gukwana igoro ye family gete buna barabarogi umwana mbakochaka kolengera lyo borogi ngento kieki unaona unajua mtoto taramenya nse yamanye bintu bingi lakini bono kuachaka komubeka ochaka kohetie ne bagete sesa ulioro chene be no bono umwana kiragweta asigete ochaka gutwara ubwo ne bagete oyo igano tari monto muya iko emangana to go feed abana baito what we give our children inaingianga hapa it sticks in their mind Pia mwana sana daktari Lamek, I hope umesikia na Bible mwensi moto ligiriti kiagera abana aba na barumbono bagukina tigatubeka se foundation yengia abana mbatora stress abana mbatora depression because of the ebikorwa bya Bible mukora managa mwana kumibono nkieke ugwa kumongino goroi posibu abana kwa motebiendo kinds of sorts of words yagaranga abana batuara stress yetayo. Daniel de Senior Mweresa gotabanga in the appreciation by the government in Ndoto. They only appreciate their political sycophants. Daktari, be blessed, good work, God will appreciate you. Nero tabirenga choganyo chota biga siaonengia utangoja. Jeffrey Nsonga gotaba morning from Nakuru County na tuligiritia senchira yobo ikirano kigima. Joshua Munguru Ishmael na wate konsana wate banga kuranya tieko milimani ni kama hii topic imemwingia sana. Agote banga question is ACT treatment, you have said it is normally used only in pregnant women as a care of patients. Can I request my patient to go for ACT treatment after fall of medicine? Agotanga garama lyoga ngiroko ligasi na mwire akorwe ACT yes na ende is it only for women pregnant women nera goteba nkora lindara barwaire na tumo murwaire achakorwe that thing na ende gotoka kire Ktrh and is it working? Yes biamono sana
Joshua Munguru Ishmael
mbiyamona sana Joshua seri boli elio abuna naira sera ECT teri gutumika ase pregnant women boka ECT to gutumia asa abantu batore treatment failure especially depression and mood disorders bali ba toira maliogo torangire correspond na again ase egendo to gutumika ase pregnant mothers because of the adverse side effects of the drugs ngoligere litore you usually look at the risk and the benefit of a drug tutara muruero ndensi eliogo kiagara nonye ina wa medical ethics ngote biguture do not do harm don't harm a patient iko tutara chiko muruero eliogo nkuligere litore risk versus benefit if the benefit of the drug outweighs the risk of the drug then we can give the patient but if the risk outweighs the benefit afadhali togotigo chandeke igo tuligie nchere ngao yo gukurwari ntokweli ogeriga so oyo no mongino bwate obolito na bwato mwana eliogo ko mwangu chwa affect so you look at the child too onye ligo chikoleto muchando you don't give that drug that's why we go to ECT but it's not always as abantu bawa afford nowadays we have amaliogo alia kunyara gutumika ase abasubati bari pregnant na ari safe na so mwana yeah igona teba it is the last option kere bibinde byonse bibya nanda senya gitari yeto ya Ktrh is on the process bado teracha our CEO mtu aligete proposal which as CEO and is working on it.
Okay.
Yeah, he's working on it. Na dikirache will be very happy because usually we refer patients for ICT to Madari kusena Nakuru.
All right. Yeah, tigeche so that services nalichiko bange na bantu. And we trust the CEO, we know him. He's a man of his word.
Sure.
Na bahago kole binti byonsi binyalikane. And Polycarp from Nyanchwa nauliza ukiwa na depression unaweza kuwa na headache. Agaro mutingo mwatio kare bona tari go differentiate malaria, stress, depression ni nini?
Wono tigante yo murigererio itanya ale ku understand depression boronge na kiere.
Yes.
Ntoko tumia symptom ya moyo nsikotebo muntu nabwate depression.
All right.
You must have at least 3 of the symptoms chirina kwana. But abantu mbali bagutwara togoro kabuna some vague pains. Mono abangina bagotono bagocha na hapa syndrome. Elia goteba mbwate peni gete koruga iga kyongotira ya chamba kokugoronsa iga. And there's no relationship medically ati peni radiate koruga iga chego chaga. So without akonya go complain umuntu utalikoera na peni kila tulikoera. Those are some of the symptoms, especially as abantu bare elderly chia depression. To ganyago tayati na what a depressed mood. Yeah. Mono abangine bagocha na doza hapa na hapa. Peni gete koruga iga ya chamba koko bako gaiga kwararire gusetari kurara biya mutu ko mwati arosete diokalioka guse uko kwano kwa arosete diokalioka igo headache can be a sign and symptom of depression but we cannot choose headache alone to say this is depression. Other symptoms,
so one of the many symptoms,
one of the major symptoms that must be there is a
headache,
low mood. To diagnose depression, low mood, loss of interest, na sleep disturbance. Alafu bone those other symptoms na bachigo chorro.
So we cannot rule out you have headache, you have depression.
Headache can be brought by so many things. Headache can be brought by meningitis. Headache can be malaria. Stress,
anxiety.
But kiroro chwa tore headache yetari ko tobate migraine headaches, tensional headaches, chiroro lioka. Go and seek help mapema. Yeah.
Inende to ganyango to ali manyererio ma kumanyanga iko nimbwatu muchando gute. Always go to the hospital.
Actually no rochekera aga symptom akubuna headache ya chire persistent yetari ko era. Kira wa chire nyagitari will help you now discover that you have some other symptoms. Kera maswali nari toko kuboli buna nago tabeti ntobwate chifomu toko kwa wicholi for self diagnosis. Ntobwate assessment tools cho wicholi na bako konyo murwere wicholi gosenabo awicholi era monyene.
All right. Bia mana sana tutaraenda impacts chirare tuna na depression kero muntu twari manyererie bibono we have ruled out this person na bwate depression ere very severe gusere moderate impacts kira era leta sobugima bw'omuntu yo alafu ngoboli narenge liboli ndinarora samuyagara kineria machirgo nsireria. Anyway, tuende hiyo nikiona mahali imeenda sijui meruka na botoko yeligiria umuntu ubwate depression mboko muki era moretere ase enyumba yaye ase kenyoro nonye na ase agokora mirimo yaye.
Okay, the major outcome of depression was second taken depression yakoleta na ndikirikiro muntu abwete nigintu yekoro kubuna impairment in functioning.
Okay.
Gose reduced productivity. Omuntu revno tari konyara go participate in the things they used to do, and that means it's going to affect the family, psychologically, financially, economically in many areas, because actually treating depression is very expensive. Kurwali depression abantu ba spend chibe sama lyoga are expensive sana.
Okay.
Mono kiratari kutoka sinyegitari cha serikali. Amalyoga depression na bongo kwa an example yelyoga limoria depression. Liko genda one tablet goes ilikuwa ni around 160 shillings per tablet. One tablet.
Went kwenye tumeka for a period of almost
1 year. It's very expensive, so it drains the family, it drains the patient, it even brings now effect cha trip mpaka say government na kiokorora government spends a lot go treat yo goroiro na kito bwanta koteba. It's good to do prevention agare a burden iliyo kurwali iranense kwa the government is currently concentrating on treatment rather than prevention.
Yes.
Because okora prevention yubono abantu abakora ku CHPs community health promoters babwenta gukora itatusaidia sana ku reduce easy prevalence ya depression iranense egaren ba family nchi go spend monaso kurwali umuntu what depression. Actually being admitted in a psychiatric hospital Italy Buna Ktrh is very expensive. It's the most expensive compared to any department. Na kinalo cha kubolinga how expensive is treating depression lakini already kwa irani iringa. It's not something kere cheap. It's not cheap.
Umuntu takanga ebu atoke so that anyorno mchando yo itakuwa very costly because dawa yake ni very expensive. Eya ndata tume questioninga what is that one thing usokonyora the direct department ili wana tukubeka mangana ona endonyolenga ni call that whatever you are asking for so that to better the department ya
mental health
ya mental health talikisi county yoka but generally Kenya ngima because igenteke nkelibo songa uka nkelibo sioka. Yes
mia mono sana sara siri boli elio na ande actually eri neli boli ligia sana egente enchina tebe ke bwente gokorekana mtu awate mental health task force report ya after baonjokana nite Kenya ngima they came up with a report.
Yes
the only thing that can be done it's the government to implement that report. For example, in the report, it was suggested Kere County etwara standalone mental hospital. Kwarolire Kere County etwara standalone mental hospital equipped the water malio Keregento.
Yani buna tokota kisi teaching and referral ere kivyake ni yuebe.
Tigangana ni example Kenya gitalira alone ya mental health madare. Ego kire county to ale madare ya. It bono teri gochiko buna ati mada eliete madare omaita bante bakuri. So it is a mental wellness center. Kire county ne bwente gotwara a wellness center. Elie gokonya iranyare gokonya but I appreciate what the government is trying to do especially in Kisii because kerato aligete tonyora malio getari kobera barore way too expensive wisiko enya gitari buna Ktrh ya provided most of those medications tokonya roka second generation and psychotics kegara na arabu at less side effects compared na alia kale bono buna dio baliko gorusko buna siringi 80 koru Ktrh na bokoli nyora nonye na 30 shillings kwarolire irine cost reduced tie kagenda sesa aseigo nchege ntonda atebe implement the task force recommendations chiricha bige twaroro na andi tigatonyara ko batoro to recruit more mental health professionals because actually we have very few mental health professionals. Some counties don't even have a mental health specialist. I don't want to give examples but chi county njeli stabu atiene mental health specialist. In Kisii we are blessed ntore specialist mental health we are like is it 4 or 6? We are 6 sub county mbaro babere na Ktrh ntore 4 4 igoto wate 2 consultant psychiatrists 2 psychiatric clinical officers and it's sub county chirito gatwara 2 psychiatric clinical officers waroro
so there is need
actually every sub county should have one more than one specialist in mental health.
All right, kilio chako kitasikika. Wantu bonsi eketali kereronga nae kegokonya. You are fighting for the people kiagera nayo linabarabu all the time. tomorrow whatever is clinic day abantu ngocha bali more than 200 patients so you see there is need a department ye cover independent. That's why nateba it yani independent kabisa
tegere nonyina barera bagocha bange twese gutora clinics chikorani bono buna ogembo nya reduce before ogembo na nduru chiche we used to have so many patients bagocha Ktrh but bono buna nduru no ogembo bachaka go correct clinic we are having the numbers here chikogendanse because abande to abarifere to abatebiri munyigitari nara sigete ogero monto konyo kurwanga it reduces on transport the cost yo kugura maliogo kiagera tibasa chiri murera gutumya bune transport abagutumya agora maliogo because they are on medication on a regular basis
and by the way again to kirabe kiekerere independent nabo mokobe kirwone budget in every financial year there is a budget allocated for that thing so that even they binde bisini
actually you can take you kwandekia SH proposal task force there should be a budget set aside for mental health
taliye moko yani moko minyororo kurwase aifai
itatsaidia sana
thank you so very much daktari nashukuru tetukulira bwase bono ndochiga kuruka mayaka from Kigogi Mara nyagotaba thanks for the good information daktari. I would like to ask that is depression related to ulcers as in can depression end up to ulcers noba aboltia tebia information
this word really sana people have been confusing depression and ulcers
sure
jinichi ali sambwate chali sangi cha ebirengerelie bingi so we have a different between ulcers and depression tetenkwa na legoro ya ulcers ulcers ntobate gento gekoro kuna stomach ulcers kose peptic ulcer disease peptic ulcer disease nature ulcer chigo cha either in the stomach or the duodenum ascenda and they can come due to several things but the most common cause of your ulcers ne bacteria koroku Helicobacter pylori or H pylori ne recorreta ulcers ego other things no muntu gutumia painkillers geta chikoro ku NSAIDs for a very long time goreta chira ulcers again tukenega correct ulcers is chronic use of alcohol ne recorreta ulcers lakini depression na ulcers telimono although again tonda tebe depression ina kira reta ulcers kero muntu ko gachigu kwigure gento getebune ge kuminyoka iga kwigune na yage ya overproduce acid turakwane gento gekoro kwa acidity but nturi gukwana igoro ya depression and ulcers igaba na kyora nyora abantu bakare gotebera nkyo mwana nera gutwarira atatwara chialsa actually no roche gende chialsa niko ibunda abantu nimbwate chialsa igo nimbwate depression
nimbwate brengerere pia mana so kebeka like that unfortunately daktari our time is up wacha nishukuru kwa njia ya kipekee sana nazidi kubarikiwa to find time to come and educate our viewers taligento kirumuchia so barikiwa sana naendelea na kazi nzuri but before that daike moyo kaiga kwani umongino lyo gwanjira kwa runyomba kabisa mama watoto egererende nere eigwenga amesalimika na baliyora ni kukwanya under 1 minute please
mbia mono sana Sara mbia mono eta ya TV ne timu inge mayete ya TV asoko ngarigani asomoro velioyo is always my pleasure kuchagoshia na our people kiagare ina riga sinya sato bekreta enseye again tonda kolera goteba tigato konya abantu baitu babwate mental illness onde bonse na bagotwara burere bweke bongo no nyini nche no nyenaye andonsia sorry tigatoba konye tigatoba tegara tobarete nyagitari salam chane ngo tomase familia ne my dad Francis, my mom Helen, my wife Virginia, my siblings tinko bakwana Maria Tonsi and my 2 girls.
All right.
When
baba ya
I know they are watching. I have my daughter Camila and Chloe. Bakotaka kwani erietali yabo.
Ndaliba kumanya kwa bakwani.
Kumanya na bakwani sana na nimba nchitanda onsiesi bale and to all my patients bali nkorora ngo basabira nyasaba konye egere banyare ko bakugwena as they continue with their medication.
Thank you. Pia mono sana. Angira nilio mwingina Virginia. Thank you so much for making daktari look like this. No mwingina Helen pia mono sana mama. No mwingaka ndonsia sole. And your brother naro kura tubuati from diaspora. Erotinda morad metu senega asia but all the same. Thank you so very much. Tigamba kire mwensi baligire jumoro kule kurusa 12 mpaka bono chiara girida ke mwigoro chinsenye chabono mambia chinga kitogo koro morobole kabisa ngakembia mano ucha saba mintu balitwa bwateranire tindikweba Joseph Mokogoti tindikweba Joshua Uta tindikweba Thomas Ngoto above all Ven Moriango korazen semwende ye studio tindikweba Twin Empire nera toko banera ga Brighton Makoli kulinde gasukake notwalenge na daktari akoro kwa Rodgers Omuya Korwakisi Teaching and Referral Hospital otineta mangana yokuligereria abantu bali babwate omuchando bwobonko bali bagokonyo nenda okoliga singia. Keep doing what you are doing ekiagera malipo utayaona tu kupitia kwa vitendo. Nyasago tebanga ekora koligasi to wakangambia mana sana inchinkoro kwa Sara Nyarangi on Twitter wancho muligereria tumerane saa 7 asemesa ya maya asinchira yobwenge twara litkoligia twara obuligererio bya imeyeta ya TV oborabu bwagusi. Thanks so much.
TV Oborabu Wagusi.
Ne nobwate ebyasara gusemega uraganie tukubikirira itangazo ebene sukuru eduka inyagitari inyangi gose amatanga vono na bugutwakira esimi ase namba inoti sana ibere isato isano isato 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 inoti inoti kumanya mange mono na buigo na bugututarira asensemo ya Nyamataro Itaya House mwese twabariganirie.
TV Oborabu Wagusi.
Rero asobo chenu waito.
Okay, stage 3 cancer, 20 years. Kinikongaine but inategemea treatment kikwanyora. Yeah.
Right. And how do you treat?
Okay, cancer to treat ngotumia therapy yo chemotherapy kuna surgery na radiotherapy. So ekobati cancer kyomurira gwate mbale bako kolero surgery kwanza bamanya ko chemotherapy alafu pia na radiation eyo takoroko sambelele alafu mbale bara chemotherapy na maybe cancer yoke kubwati mostly cancer njira kwa